We're here today with Laura, and Laura wants to work on her little acne spots. And so one of the treatments that we do for acne scars is to, not acne spots, but acne scars, is to use Dermarollers and Dermapens. And unless you're in this field, you probably don't know the difference. And there's a subtle difference, so we're gonna demonstrate what they both look like and what makes them different. So this is a Dermapen. And if you look here, you can see it's just pins on, it's like a little jackhammer with little pins on top of it. And can you see that, Kendall, enough? Good. Okay, so with this, the Dermapen, basically, it just goes up and down and up and down. It's going so fast, you can't really see it, but what's happening is it's a jackhammer with these little fine needles that are going up and down and really, really quickly, okay? So, and what's nice about this is we have different settings for it. We can either set it at a depth of 0.5 millimeters, a depth of 1 millimeter, a depth of 2 millimeters, or a depth of 2.5 millimeters. So if we pulled out a ruler, you would see it just varies in how deep it's going to penetrate into the skin. Now, the difference for the patient experience is if you're at a lower setting, it's going to be easier to move it around because it's not going in as deep, because when it goes deeper, it's hard to slide it because it gets stuck. So that's number one. But for the patient experience, it's going to be more painful the deeper it goes into your skin. So that's the difference with this. Now, if we have a Dermaroller, this is just a little pinwheel, and you can see it just sort of rotates like this. So you can see it just spins, right? And so it's just a wheel with little pins on it. And so with this, what we're gonna do is we're just gonna drag it back and forth on the skin. And with this, we're gonna drag it back and forth. This is gonna roll, and this is gonna jackhammer up and down. Jackhammer sounds pretty severe. It's just the only way that I can think of to tell you what it's like. Now, when you read articles about this, one of the things that they say is there may be less trauma using the Dermapen because with the, with the Dermaroller, because with the Dermapen you're gliding it and so the needles can get stuck. But to me, you get the same kind of situation when you're rolling it, because as you're rolling it, the needles are going in different directions, so it can get stuck a little bit as well. So in terms of efficacy or how well it works, they're essentially equivalent. I tend to use more of the Dermapen because I'm lazy and the Dermapen does the work for you. With the Dermaroller, I'm afraid I'm going to get carpal tunnel. Now, what about you, Laura? You do this. Which one do you like better?
Honestly, so I like the Dermapen better. I think I get to the clinical endpoint a lot faster. Pinpoint bleeding and whatnot. Sometimes with the Dermaroller, you have to push really hard. And I think that it hurts the patient more. Where the Dermapen, it's like, sometimes you can do circular motions, you can do back and forth, and so.
Yes. So, and I think it's really important what Laura said is what we're looking for is the end point.
Yeah.
An end point with lasers and with devices, what we're looking for is an end point. And that's how we know we've achieved our goal. And so with this treatment, with either the Dermapen or the Dermaroller, what we're looking for is a little bit of bleeding. And to me, the bloodier it gets, the better the result.
Yeah.
And the nice thing about this treatment also is that there really is no negative effect that I've seen.
No.
I mean, in theory, you could get a scar, but I've never seen a scar. You could get pigment discoloring, but I've never seen that happen.
It's very rare.
You could get what were you going to say?
Safer than lasers.
Safer than lasers,
for some
yes.
patients that are darker skin type, we always worry about the post-inflammatory hyperpigmentation. And with some darker skin types, we can do the Dermapen and Dermaroller and not have that post-inflammatory hyperpigmentation as we might get with something like a CO2 or something like that.
So what we like to say with this treatment, it's colorblind. By that, it means we can use it on any skin type, whether you're Hispanic, Asian, African American, Caucasian, Mediterranean, Middle Eastern. Did I leave anybody out? Native American. Mm-hmm. So we've covered everybody. So, but the thing with this also is that it doesn't have some of the features that the lasers and devices have. It's not going to target pigment, or it's not going to target red blood vessels, and it doesn't have heat to tighten up the skin. So it has its place. One of the other advantages to this, I think, for people besides it can be used on any skin type, is that it's less expensive, so it's very affordable. Mm-hmm. Which is kind of nice. What we're doing is we're numbing Laura before we get started because it can be quite painful. And sometimes we'll do a topical lidocaine first, and as well as doing the injection. So here we go. We're going to start with a Dermapen. And here we go, Laura, are you ready? And we need to do, with this, we need to do just a little something to make it glide on the skin. And so what I'm using today, what they gave me is BOBW Vitamin C Cream.
Yeah.
And this just allows us to glide the Dermapen on the skin.
And it infuses vitamin C, which we know helps to brighten the skin, so it's going to hopefully make it look glowy and beautiful.
Which you already do, Laura. And I have it on 2, so let's go to 1.5 to make it a little bit easier on you today. I think
about the at-home rollers.
the at-home rollers. Has anybody in the room tried those?
I have.
How was it for you?
So here's the thing. When you're doing something on yourself, you're not going to be as aggressive as when you're doing something or having someone do it for you.
Because it hurts.
It hurts.
It hurts.
It hurts.
Oh my gosh, I tried it because I
Yes.
thought it was such a great idea. So I tried it at home.
And I was like,
One
oh,
pass,
yeah.
I couldn't do it. It was like too
cursing
much.
at myself, like, what the? Why am I doing this to myself? You know, but right now, like, I'm totally fine. And I think it's because doctor's doing it. So, you know, and also, you know, I think that you really should be, you know, professional to do these kinds of treatments because you really can have some things that could go wrong. I mean, although we've never really seen it, you don't want to do that to yourself. So I think it's better just to come in and have it done. It's a lot easier, it's less painful, you're going to get better results. That's my take on it.
Right.
And then in addition to that, you know, we use medical grade products that we actually infuse and infuse into the skin. So for example, we're probably using about a 20% vitamin C serum here, whereas, you know, at home, or it's harder to get those things, you know, for your own use at home unless you have a license or something like that.
Exactly. Now, I also wanted to point out what we're doing is we're doing different patterns here, and you can see I'm doing crisscrosses, and then I'm going diagonally back and forth to try to make sure it's even.
And I just want to say, I'm not feeling any pain right now. So,
Okay.
you know, I think the numbing too is a huge benefit to doing it in the office as well. You know, because I really don't feel anything, but I'm sure he's getting a great treatment because I can hear it.
And now you can see I've gotten a great result because look at that endpoint, pinpoint bleeding. And I think one of the things that's great about this treatment also is we're talking about delivery, ways of delivering products into the tissue. And Laura talked a little bit about delivering vitamin C, but we can also deliver things like PRP. And so you're taking your platelet-rich plasma, also called the vampire facial, which is patented, so I'm just mentioning it, I'm not saying we do that. But so you can infuse the growth factors into your skin. So you can infuse growth factors and other things into your skin as well.
Which is really exciting because those are things that are still kind of, we're learning about, you know, so it's a relatively new procedure. But it's great because we can just use your own platelets, you know, and they have all these great benefits. So, you know, we love doing that too.
Right. So now we're starting with the Dermaroller, and you can see, for those of you who are just learning to do this, a lot of times you start out by going like this, not using your wrist. It's really a wrist action kind of phenomena. So I'm just sort of flinging my wrist, and you can see you're starting to get the pinpoint bleeding, but it's a lot more technically challenging when you're using it. And you know, with the Dermapen, you just sort of gently glide it along the skin. Here you're having to apply a certain amount of pressure, and it's just a lot more challenging to use to me. The Dermapen is kind of expensive. I think it's about $6,000 or $7,000 for it. But to me, it's worth it when you do a bunch of these. And you can see I'm not really even getting the same endpoint as quickly or as evenly using this as I do with the Dermapen.
See, and that's what I noticed too. When I do this, I mean, you really have to push hard to get to that pinpoint bleeding endpoint, and a lot of times patients can't even tolerate it. So, you know, you might as well just use the Dermapen. But I mean, they're both good. They're both good. It's just that I just think that I favor the Dermapen too.
For me, it depends on location though.
Yeah.
Where's tell us about the location.
Yeah. So for example, for the Dermapen, I like it because the depth would be different on the nose and the forehead as opposed to the cheeks.
Yes.
And then also with a Dermaroller, I like to use it in larger areas because I can get much more coverage as opposed to just using that Dermapen, that little surface area.
Yeah.
So like the abdomen, if I have to do the abdomen.
Oh, I see. So if you're doing body, so you like it for the body.
Yeah, I love that.
Yeah, that's a great
I
idea.
kind of agree with you there. In fact, as a matter of fact, we had a patient that we did a pico on that has some pretty resilient tattoos, and we used the Dermaroller, and I was able to get to where I wanted, you know, to kind of just open up the skin a little bit more, allow the pico weight to get in there, and maybe hopefully get better efficacy of the treatment. So I do agree with the body. It's probably a little bit faster to do.
And now I just want to point out, Kendall, again, we're doing different patterns to try to make sure this is even. I'm doing a crisscross again, and then I'm doing a horizontal, and then I'm going just back and forth to try to get the optimum result.
It actually, you know, honestly, it doesn't hurt. I have a huge zit right next to my lip. And I was like, don't let anyone see. And sometimes I feel it over that. I don't know why. I guess my fear is that it's bleeding. Am I okay?
Okay. And so now that's the end of the treatment. And when we do this, the aftercare is really simple. All we're going to do is we're going to put a little Vaseline or Aquaphor on top of it. We want to have sun avoidance for just while it's a little pink and swollen. And there's really nothing else to it. You can go ahead and live your life. You want to avoid makeup for 24 to 48 hours to let those little pores heal up. Now, the one thing that's interesting is we talk about infusing after we do this treatment, but it's really, you have 10 to 30 seconds to really infuse that stuff. So if we're going to infuse, we want to have a nurse or a medical assistant going behind us and putting it on as we're doing the treatment. So that's all there is to Dermapen and Dermaroller. If you have any questions, you can contact us at contourderm.com.